Hello, everyone. Welcome back again. We are here to talk about Radies, which we recently brought on. So if you don't know anything about it, Radies is one of our biostimulants. So it's kind of a mix between a filler and a biostimulator. So one of the newest ways to use it is actually in their neck treatments. So Liz wanted to talk about what they call the Merz Gold Protocol today.
Yeah, so Radius is really versatile and it can be used a lot of ways, but I like to use it as a biostimulator. So the neck is a tricky place to treat, and we have a lot of people who neglect the neck. And so that's why I really love this treatment. So the Gold Protocol is a combination of Radius diluted down so it's nice and thin liquid, Bellatero, which is a very soft hyaluronic acid filler, and Xeomin, which is like Botox. Yeah. It's a neurotoxin. So you're getting biostimulation, you're getting relaxing of the platysmal muscles from the Xeomin, and you're getting a little bit of filling in these necklace lines that we get in the neck from the Bellatero. So it's kind of like an all-in-one treatment, and it does amazing things for the neck.
Yeah, it's also non-surgical. So a lot of people, obviously sometimes the best option is a surgical neck lift, but a lot of people don't want to pay that much money just to enhance their neck, or they don't want to do the downtime with surgery. So this is a kind of the next best option that's not surgery.
Yeah.
So who is a good candidate? Because obviously aging on the neck can vary depending on what kind of, symptoms or problem areas you're having specifically. So what makes a good patient for this Gold Protocol?
Yeah, so there's a really wide range of patients that we can treat with this. So even someone like me who's in their 30s and is just starting to develop these horizontal necklace lines, it's really good for that. It's also good for aging patients. Anybody who doesn't have an excessive amount of extra skin on the neck. If you get kind of to that point, yes, you could do it, but you're not going to see much benefit. But a little bit of loose sagging skin, that crepey look that we get on the neck as we age, just anything, fine lines, texture, the banding that you can see when you're kind of straining your neck like that helps that too. So all those things. Basically, anybody who has anything they don't like about their skin on their neck but doesn't have a huge excessive amount of excess skin.
So talk about how you administer. Obviously, there's 3 different components to it. So talk about what goes where.
Yeah.
And in what order.
So they're all mixed together. So you don't have to suffer through injections of filler, injections of Radius, injections of Xeomin. Basically, we mix them all together. We make 5 little puncture wounds here, here, and here. And we use a nice long little, it's called a cannula, so it's not a sharp needle, it's a blunt needle, kind of like a straw, to go in and administer it all the way through the neck. So we're covering the area from here to here, typically, and that's all just blended in beautifully together.
So what are some of the positive things that you've heard patients, you'd be like, what do they think about it?
Yeah, so basically what patients will see and what I've seen from patients that I've treated already with this is they notice that their lines on their neck are more smoothed out pretty much immediately, but those results get better about 4 weeks out. The skin looks healthier, more hydrated, more plump in a good way, and then the neck just looks more relaxed. Sometimes the contours of the neck can appear more dramatic. Since we relax this platysmal muscle, it's not pulling down so much and taking away the beautiful jawline contour we have. And then the other good thing about it is it lasts a long time. So typically patients are happy after 1 treatment. Occasionally, if you have more severe issues that we're looking to correct, it may take 2. And then you're good for 1 to 2 years. So this is not a treatment that takes a lot of maintenance, which is really nice as well. You may need some maintenance on the Xeomin in the neck, where we may just inject a little bit to keep that relaxation in effect. But as far as everything else, it's good for a year or 2.
Yeah. And we are also doing a special on this.
Yeah, so we have a special coming up. And so that special is going to be the treatment, the Gold Protocol, the Radius, the Bellatero, and the Xeomin all together for $1,200, which is regularly going to be about $1,600. So it's $400 in savings. That's really good. So you should take advantage.
So to close out with a little tip is that when you do your skincare, carry it down to the neck. It's the same skin that's basically on your face. So, you're doing all this anti-aging for your face.
Yeah.
So while you're at it, just do the neck too. And honestly, you can kind of avoid a lot of the typical aging that you get with the neck.
Yeah, put your sunscreen on your neck too.
Yeah.